Well, welcome everyone to the Performance and Audit Committee of Wednesday, 20th of May. So thanks very much for coming in, and there's some good papers there that we have a chance to ask lots of questions about. So are there any apologies for absence?
Can I just, before we start, Chair, can I just remind everybody that the meeting's being recorded and will be placed on websites for public viewing. And I'll now just do a roll call for the minute. So Bob Benson.
Present.
Thanks. I've had apologies from Councillor McHugh, and I had thought Bailey Wright was going to be joining, but I'm not seeing her there yet, so I'll keep an eye out for that. Councillor Toland.
Hi, I'm here.
David Cheap.
Present.
Dave Berry.
Present, Arlie.
Christine Jones.
Present.
I've had apologies from Sanjay Pillai. Glenn Lloyd. Not seen Glenn. Jocelyn, I think I saw Barry. Barry, are you here for Jocelyn?
Yeah, I'm here. Thank you.
Thanks. Raymond Marshall.
I'm here, Arlene, thanks.
Martin Sloan.
Present.
Okay, so that concludes the roll call. Oh, sorry, that's a message from Alison saying she's here for Glenn. Thanks, Alison. Okay, so item 1, apologies for absence, are already noted. Item 2, declaration of interest. Are there any declarations? Not seeing any declarations. That takes us then on to item 3A, which is the minute of the previous meeting held on the 4th of February. And that's submitted for approval.
Okay, thanks very much, Arlene. Do we have any comments on the accuracy of the minute before we accept approval? Okay, thank you. Can we now just approve that minute?
Okay, so that then takes us on to item 3B, which is the action tracker.
Who's taking us through this today, Dave?
I can just kind of talk through it.
Yeah.
In general, I mean, I know we've kind of gone through kind of last time, kind of almost like line by line with them, but I don't know if you want to kind of do that this thing. So there's a number of them, sorry, Chair, that have now been noted as complete. So if the and hopefully the committee is minded to recognise these are complete.
Can we just confirm that? Are people content with the complete items to be archived? I see nodding of heads. Okay, Dave, do you want to just talk about anything else that's in the in progress?
So you'll see that. So there's also a range of actions that are down as amber that are in progress, not quite due yet. We've got number 2, 3, and 4 are due for September, so we'll make sure that those are cleared by September. We have got one which is kind of down to number 6 in terms of Hope Point. So that is, we're kind of working with Hope Point to kind of see what stats we can get available. So still in progress, although acknowledge it's down as May, so we'll probably kind of change that to red since it's not been ticked off for today's meeting. And then items 8 and 9 are down as later on in the year for completion, so down as in progress as well.
Okay, any further comment to the action tracker, David?
Good morning, everyone. Just a quick one, Dave. Are we picking up on the part from the minutes of our last meeting about the Kingsway Care Centre today? It did say there that that'll be brought forward to the next meeting. Will that be mentioned at all in anybody? I mean, I've tried to go through the reports and things, but there's no direct referral to that, I don't think. Just see, I think it's.
So apologies, mate. Was that in the previous minute? Did you say? Or,
yeah, it's on page 2 of the minutes of the last meeting. It said that to note there was an update on the roof works, which we brought to the next meeting.
Right, okay, so apologies, I hadn't kind of picked that one up. So that will come back to committee at a later date.
Okay.
There's an options appraisal being undertaken at the moment around Kingsway, so that will be brought back in due course, David. Sorry, I hadn't picked that one up.
Yeah,
No, that's fine, thank you.
and thanks, David. Also, of memory, I think it was raised at the IJV in the intervening period since that minute. Dave, I'm sure you've talked about it on several occasions since February. Okay, thank you very much. So we note the action tracker progress and we archive those that are now complete. Arlene.
Thank you. That then takes us on to item 4, Dundee Health and Social Care Partnership Performance Report 2025-26. Sorry. And Catherine's going to speak to this. It's for no.
Actually, it's Shahida that's going to speak to it. So
This is well we didn't get that email. Thank you.
Hi everyone. Right. So the purpose of this report is to give the key information on the performance of the national indicators, the MSG indicators and the social work demand data. So most of the indicators are for the rolling year for Q3. So this is January to December 2025. So we have compared against the two baselines, 2018-19 and 2020 and 21. So the formal baseline is 2020-21, but as you know, that was affected by the COVID pandemic. So we have compared against both the baselines. So the data continues to show variation across the local community planning partnership areas. So the rate of emergency admissions per 100,000 aged 18 has increased in comparison to both baseline years. So increases were observed in all the LCPP areas and the largest increase was in the Ferry. There is variation with emergency bed days per 100,000 against a 2021 baseline. There's an increase against a 2021 baseline, but a decrease against a 2018-19 baseline. And there's also variations across the LCPP areas. The 28-day readmissions rate per 100,000 is increased by 8% in comparisons with both baselines. Some of the LCPP areas do show an improvement. Hospital admission rates due to a fall for the over 65s has decreased by 1% when compared to both the 2021 baseline, but increased by 3% against the 2018-19 baseline. East End, Coleside and West End show an improvement against both the baseline years. Delayed discharge for standard delay shows a decrease against the 2021 baseline, but an improvement against 2018-19 baseline. For Code 9 delays, both baseline years show an improvement. So the social care demand data, the number of people waiting for social care assessments is showing a small decrease. The number of people waiting for a care package remains low. And that's my update on the performance report.
Thank you, Shahida, for keeping that brief. Thank you so much indeed. Just before I open up further, as you know, we have a baseline of the 2018-2019. How relevant is that baseline now, given the demographic changes and the demand pressures are really quite different now from the COVID era or the pre-COVID era? And I just wondered why we still need this.
I think when we're looking at the COVID years, the data was showing a lot, obviously the hospitals were empty and there was the data showing a different pattern. So that's why we still use the 2018-19 baseline. I think when we report for the next financial year, the baseline will be 2021, 22. So that'll probably show more of the normal trends.
So Shahida, will this kick in then from the beginning of the next financial year?
Yeah.
Okay.
So hopefully should be able to go back to the one reporting year.
Right. Thank you very much. Okay, I'm going to open it up now to questions from the committee. David.
Yeah, thanks, Bob. It was good to see some things here, some positive improvements. Clearly, what you mentioned, false-related admissions, which I know people have picked up on that as a highlight before. And we know about the cheating, falling, delayed discharges. Once I'm trying to head towards the some of the areas in the local community planning partnership, and you mentioned that I think you mentioned the ferry there. I think Coldside, Strathmartin still appear to be poorest performing areas, and I just wondered whether is there some sort of strategy in place or being prioritised for these poorest performing areas that we might see an impact over the next 12 months, or is it a more generalistic approach, or is there anything specific to these poorest performing ones?
Shahida. I think you've gone mute, Shahida. I see it on your screen.
I think Dave's waiting to speak on it.
Yeah.
Do you want to go first, Dave?
Yeah, no, that's fine. I'm just going to put a general comment in there because I think it's a fair question from David around that, because I think there are different reasons why you've got kind of different sort of performance. So the ferry in itself's got kind of a greater proportion of older people as well. So you have that sort of impact. So you've got a relatively kind of wealthier part of the population, but kind of an older part of the population as well. So there's kind of different supports and interventions to be required in there compared to some of the other areas. But in terms of answer to your question around are we specifically targeting, there will be kind of particular kind of services that are wrapped around the areas of greatest demand. And that'll be across our kind of our services, so whether it's around kind of social care or community nursing provision, etc. We'll be kind of looking at where those areas of demand. It's probably something that we've not managed to kind of shift an awful lot of focus on relatively recently due to our kind of financial constraints, to kind of really sort of target some of those particular areas and shift resources around the city to where they are. So it is a challenge for us, and it's one of the kind of key elements set within our strategic plan around trying to tackle those different inequalities that exist. So there's not a kind of magic wand to kind of that we're able to kind of just say put all the resources in this area, but there are kind of say particular resource shifts across where the kind of demand is needed. I know there's other kind of initiatives that we work with in terms of that wider system. So there's kind of more information coming soon, but there's whole family support sort of focus within Dundee that will kind of look at that more targeted sort of kind of neighbourhood specific support. You did hear as a committee previously around the Lathan Pathfinder work. So again, targeting specific areas in the city to look at how we can best support as a wider system as well. So yeah, not an easy kind of fix, but something that we're certainly kind of paying attention to.
Yeah, Dave, if I could come back, if you mind, Bob, for a second. I think that's really, it is interesting though with focus, because I picked up on these three, because clearly there's market differences in there. But if you take Coldside, Strathmartin, then you bring in the ferry, the Botty Ferry particularly, and I suppose it just goes to show that you mentioned wealthier areas. That can bring its share of problems in itself, because clearly the demographics are so different there. That it's the things, the demographics and age that cause the issues. Particularly, it's not so wealth doesn't solve everything. Is what I'm trying to say here. It's demographics have as much of an impact as perhaps income and poverty is concerned. Thank you. It's just a note that was thing. Thank you.
And thanks. And of course, I find it increasingly more difficult to read across from the different ward reporting. So it seems to vary each time we have an update report, and so much of it is often in the red in any case, apart from delayed discharge, red days loss rate. which it has been very positive. But I suppose it comes back down for me to the preventive work, Dave. If we're talking about, and I think that was getting to the kind of where Dave was at. I think David was that if we can hit into the prevention work, then that should be affecting the emergency admissions and the emergency red day rates, for example. And I suppose it's that area that I would like to see explored much more. I'm going to ask Shahida. Shahida, do you have any further insight into this?
Sorry, no, I don't. No, not really.
Okay.
Yeah.
Right. Any further questions on this performance report? I think it's also worth, because there is a lot of data in this about this continuous issue around the premature mortality rate. Siobhan.
Thank you. Apologies if it is in the report. I can't seem to find it. So I'm looking at 5.2 in terms of waiting for assessments. And the figures look really good. We've got 0 people waiting in hospital as of March for a community for social care assessment. We have 7 people were assessed and waiting in hospital, and then 12 people assessed and waiting for a care at home package. Do you know what the average length of time waiting for that to be put into place? They've been assessed, but how long's the average wait time for those people?
Sorry, the fire alarm's going off. But I could find out for you and get back to you. But usually people don't wait long for packages, but I can find out what the average time is.
That would be good. Thank you very much.
Thank you. Okay, then, are there further questions on this report? I don't see any hands. In that case, could we just note the recommendations from 2.1 to 2.4, and thank you very much. Okay, thank you very much, Shahida.
Okay, so that then takes us on to item 5, which is the Clinical Care and Professional Governance Assurance Report. It's for a decision and will be presented by Matthew.
Thank you, Arlene. So this is the Clinical Care Professional Governance Report, which we're offering today for reasonable assurance for the reasons listed at section 2.1 in the report. I appreciate members will have read the report. I just have 3 areas just to highlight briefly. The first is the impact of staffing across the partnership, but in particular within our community mental health and learning disability services. The clinical and management capacity continue to be a significant concern, and a lot of work that's ongoing to try and mitigate and manage that, but it does remain a sort of a large concern for us within the partnership. There's an appointment to a management post in process at the moment, which will help to offset some of that. We've put some project management support in to help with some of the governance processes across this service, so that we can make sure that we've got the assurance that those very important and very complex parts of governance are being addressed appropriately. And we've released some time from our governance facilitator to work very closely with the teams to make sure they can address and stay on top of some of the governance work that's there. We are seeing some benefits with this. In the report, it says that there are 139 outstanding adverse events within mental health and learning disability services. I reviewed that yesterday. That's come down to 74. So the work is progressing nicely, but the risks continue with the current shortfall that we have there. And you'll notice through the report there are other areas with staffing risks as well. The other areas that I just wanted to raise as well, this is a little bit more positive. I think it's come through to this group before, but the mental health joint inspection for adult services. I guess I just wanted to raise this because it's really positive news for the services that we've just talked about in terms of having the real challenges. And despite everything that they're going through and the challenges they've got, they had a fantastic joint inspection service with 4 goods and 1 very good, and lots of commendations sort of coming through. Still some learning for us in terms of that, and an action plan has been written, and further reports will come back through this committee for people to review. And the last thing I just wanted to note is the referral to treatment target for psychological therapies. And it's the next report on the agenda, so I'm not going to say a lot about it, but it's just to note the improving picture for that service and the really good work they've done in the background. And they're now ahead of the Scottish average in terms of the referral to treatment targets, which is a really, really positive place for that service to be. So I'll pause there, but happy to take any questions.
Okay, thank you very much indeed. Questions for Matthew? I'm going to take Raymond Marshall first and then David Cheap. Raymond.
Hi Matthew, I'm not sure if you got it, but I'm just looking at the table B1, I think it is, and regarding the risks, and I'm just concerned a wee bit that we're sitting with a number of these risks since April 25 and they haven't changed. So, and I'm concerned if we've got some assurances around managing these risks going forward, given the financial climate that we have. It's maybe no question for you, Matthew, it's maybe one more for David. Dave.
I was going to ask you, Raymond, do you want to be specific about this? Are we talking about workforce? Are we talking about various other things?
Sorry, workforce. Sorry, Bob.
Thank you.
Yeah, that's a table for the workforce risks that we're put in there just to try and have some sort of monitor on the workforce risks, because in previous reports we've mentioned it and we're asked to provide a bit more information. I mean, you're right, Raymond, a lot of those are very static because the problems persist. We often put mitigations in place to manage that, but then the demand for the services increases as well within there. One of the risks that's within there, for example, is the lack of staff with prescribing competences with one of the services. Now, we've actually all but addressed that, but the need for prescribing has grown significantly over the period of time that we've developed those staff. So it remains a risk and it remains something that we're looking at. I think the level of risk, particularly some of those within the Dundee Drug and Alcohol Recovery Service, they are due for a review. We had a risk management meeting on Monday this week, and a number of those are due for review. Some will be archived, but they're still there at the moment. So I can absolutely give you the assurance that we're looking at them and we're managing them through the primary governance groups and the risk management group as well. But they are static. I appreciate that.
Thanks, Matthew.
David.
I'm just seeing Dave Berry's put his hand up. Maybe he wants to respond on that before I come in, Bob.
I think I'd rather leave Dave to them because he can scoop things up. You may ask similar areas. Thank you. Okay,
no, I think mine, Raymond, I'm building basically on what Raymond said, I think, because I was going to refer to that. I think that, Matthew, I think we're clearly, I think, on a positive trajectory here. I think, we are moving forward, and we're asked here for reasonable assurance, which is fine. And, but the reasonable assurance in itself tells us there's still issues there that allow us to move forward. And it seems to be that workforce recruitment, retention, etc., is fundamental to all of that. Is that principally, there are some positive things in this, but is that still the main reason, as far as you say, as you believe, that would hold us back, that would actually help mitigate further the risks that Raymond's referring to? And I did pick up on risk and saying that there are, we've got the risks set out there and they're quite articulate and all the rest, but where we have weaknesses, would improvements in staff retention and recruitment suitably mitigate them and thus allow us to move further in a better, higher level of assurance? So it's a bit convoluted, but I think they all link together to create a better governance and assurance from our point of view.
Yeah, completely. So I suppose the short answer is probably not, because this report's looking at the assurance levels for our governance systems and processes within the partnership. So the fact that we've got a report that can outline for you some of the challenges that we've got and the work that we're doing is where we're looking to derive some of that assurance level, not necessarily that everything's working well. And I say that because we've still got elements within the partnership where we don't have all of the systems and all of the compliance in place in the way that we would like it. So yes, that will contribute to it, but it's the wider governance system in terms of processes that the assurance is really sort of seeking at this stage.
Okay. Thanks for that.
Thank you.
Dave.
Yeah, thank you. I was going to come in on Raymond's point, and Matthew's kind of covered quite a lot of that. Anyway, I suppose the kind of key element for me around those challenges that are kind of set out there is it kind of comes back to our workforce planning and how we kind of make sure these issues are reflected within our workforce plan. going forward. And I think just kind of picking up on David's point as well in that context, we do have that kind of challenge at the moment around the financial challenges and balancing off the sort of kind of clinical care, clinical quality kind of aspects of that, where we've got kind of a kind of real challenge to balance our budget. We obviously went through quite a challenging budget setting process just a few weeks ago. And that kind of sets out quite clearly that we have to kind of reduce through some of the kind of change work that we're doing, and reduce the overall kind of size of the workforce as well. So through our clinical kind of governance routes, we'll be able to kind of identify any risks that start to flag up as we go through that process. So it is likely that table will start to kind of shift at different points in the year. Some of it will likely be more positive, but other elements may kind of slip. So there's probably just a bit of a kind of health warning, if you like, around that, given some of the challenges that we're facing.
Any further questions? I'd quite like to, if there are not any further questions, I'd like to go back to the recommendations. And in particular, it's looking for a reasonable, and to give the number of factors set out in 2.2. The one area that concerns me most about this, Dave, is the into mental health and learning disability area, and particularly the workforce challenges. And given that it's not shifted in a while, and just picking up what Raymond was saying, and there seem to be clear issues around about recruitment and vacancies around medical nursing, AHP and social care, which I don't think there are any staff groups left there. So I have a concern about whether the one element of this doesn't sound reasonable to me. The rest of the report is reasonable, but I have concerns about this first section on community mental health and learning disability. And I'd like a viewpoint from committee members on that, whether it should be limited or limited to reasonable. So I'd like a view on that. Matthew.
Yeah, what we could potentially do within that chair, I suppose, would be to offer different levels of assurance for different parts of the report, if that was acceptable to the committee, so that we've got some elements that we're saying are reasonable, possibly even higher than that, but somewhere that's limited. Or if you prefer, we can keep that as one overall system and have that conversation of that potentially dropping. But that's one way of maybe acknowledging the comments that we've had and the concerns that we've got in those areas.
Thank you for that. I think what I'm trying to do as chair of the Performance and Audit Committee is to flag this up to the IJV when they come to their next meeting, so that we are drawing attention from this committee to this key area around workforce, and it's not shifting. And I note the mitigations, but also note the challenges that both you and Dave have highlighted. And whether we formally say limited assurance around, say, the area I suggested, like community mental health and learning disability in particular, is something that I would wish to get a view on, and to kind of split this area, because it does need to be flagged up to the IJV. This is an important issue for this group, and it's not shifting. And Dave.
Well, thanks, Bob. Just a suggestion on that, if you may. So, the chair, I'm just wondering whether that's something you want to reflect in the chair's assurance report, which would then be presented back to the IGB, and we could kind of highlight it at that point, and that would be kind of formally minuted at that point as well.
And I'm happy to do that. And the important thing is we get it up to the IJV, so. If that could be nuanced within the assurance report, and so I've highlighted one area, which is community mental health and learning disability. Are there any other areas which we feel have got limited assurance? If that's the main one, then I'm content with that.
I think, sorry.
Sorry, Matthew, it's okay. I'll ring you in a sec. Raymond.
Yeah, I mean, I think I would highlight that we're HPs, Bob, as well.
Sorry, what's that again?
That we're HPs within the directorate, that as well. The reason I'm mentioning that is obviously the decision that the IJB made regarding the finances and the impact on some of our HP services. So I think that's one that the IJB need to be aware of in relation to the consequences of decisions that they're making.
Okay. Yeah, I get that. Okay. Matthew?
It isn't fully reflected in the report because it's quite sort of contemporary at the moment, but the community nursing service would probably be the other area that I would highlight as being an area that's under particular pressure at the moment as well. And
what about the AHP? Because I understand that that's still subject to quite a lot of review at the moment. Is that correct?
Yeah, there's a review ongoing at the moment, particularly looking at occupational therapy services. There's a national shortage of occupational therapy at the moment as well, which makes that particularly challenging. So yeah, that's certainly an area that could be highlighted.
Okay, Dave, I think you get the gist of the areas that we want to provide within the assurance report to the IJV, and these are some of the three key areas that we've highlighted, and if that could be communicated back to the board, that would be great. And I'm content to reasonable with qualifications is probably the best way to say it. Would that be okay? Would that be acceptable to committee members? Thank you. Thanks very much indeed, Matthew.
Okay, so that now takes us on to item 6, psychological therapies waiting times. It's for a decision, and Dave will speak to this.
Okay, thank you. So yeah, this one it was on the action tracker, came from one of our previous reports, where members requested a further deeper dive into the psychological therapies performance side of things. So just to kind of recap, we are Dundee's the lead partner for psychological therapies across Tayside. So psychological therapies cover quite a range of different specialties. I think there's 13 specialties that kind of covers, and the majority of them are actually meeting the waiting time standard of 90%. 90% of patients to start treatment within 18 weeks of referral. However, there are a number that have been further away from that target for some time. And in August 2024, I think it was 24, the NHS Tayside was advised they were going to be put under enhanced support to improve performance. But again, not the only board across the country that's subject to that enhanced support. So since then, the team has worked with the Scottish Government to look to how we can improve that performance. Some of that has been around straightforward kind of recruitment, but some of it has also been around kind of change in the way that we actually deliver the service. A couple of the sort of main areas of kind of change around that have been around the expansion of digital therapies, but also a lot of kind of expansion of some of the group work as well. So that's seen the totality of the measures that have been put in place since August have kind of seen quite a significant improvement in our performance, leading to a December 2025 position of 82.6, so it's kind of it's above the kind of Scottish average at that point, which was just over 80%. So the report provides that assurance to members around the work that's been undertaken and the further planned work that's to be undertaken for those remaining specialties that are kind of still kind of short of the treatment standard. And that's going to set out within the report. So there has been quite significant recruitment activity that's been undergone. So despite the financial challenges, we've prioritised this area to kind of see that improvement across all those services. And the expectations are that by November 2027, all the specialties that are further away from the target will actually now achieve that 18 weeks target. So here for an update in terms of just now to kind of show where that progress has come. But in terms of a decision, really kind of looking to instruct myself to come back with a further report later on in the year as a progress report on that. Thanks.
Questions for Dave? David.
Yeah, Bob, I will ask this. I feel like I'm stepping for Dorothy today because Dorothy's the person who's probably answering a question on every paper, but it's
don't inflate her head. Don't inflate her head anymore, David. Thank you very much.
Right. Just on this one, I think yeah, we've heard a lot over in all areas of NHS about this and how the improvement has been, and we've got to recognise all of that. I read the paper, Dave, really about, as you said, right through to November 27, where we expect to be. And I suppose, stepping back from that, I'd be just saying, look, that's great, but with all the pressures we've been under and continue to be under, do we really feel that trajectory towards then is realistic? And can that be achieved on the current model that we have, or do we need any further redesign to make that achievable? If you get my meaning on this.
Yeah, no, thanks, David. Thanks again. Really kind of helpful question there. So, I think there's like anything, there'll be a number of risks associated with this. So, we have a plan. We have a recruitment plan. There has been some areas. There's been an improvement in the availability of professionals to be able to recruit to, which has been a challenge for some time. But there's also other areas that where these challenges remain, and across the country it's difficult to kind of recruit to some of those. What we're looking at, and the new director of psychology, Horacio, been working with him to look at, so how can we expand some of those other areas that are not so intensively kind of dependent on our individual staff. So things like the digital therapies, in particular in the group work that can be done where it's appropriate to do so, to make sure that those that still have kind of psychological therapy needs, but perhaps kind of lower level, their needs are kind of met kind of more quickly, and are not kind of caught in the system, if you like, around that, which then could lead to an escalation of their condition if they're not kind of treated kind of earlier. So it will be that kind of combination between looking at how we continue to learn from other areas, what other areas have done around service improvement, looking at the pathways. So again, there's a lot of work being done around the kind of the access pathways and how these work as well. So combination of that work plus a focus on continuing recruitment to those particular posts. But we know that there's going to be turnover. There's certain services you think we're getting to full establishment, and then somebody will leave and it's back into that process again. But the current kind of trajectory based on working with Public Health Scotland in terms of where they think the demand is coming down the road, what the impact of the additional recruitment and additional measures will come. That is their kind of prediction of where we might end up with those particular areas, and we'll continue to work with them under the enhanced support measures.
Thank you, Dave. When do you anticipate the updated report to FAC? When are we going to get this? So I'm just thinking about it. So this one. So again, there's a bit of a timing of this one, because this also goes through NHS Tayside Performance and Resources Committee, which we were just this one was just too late to kind of go to our last pack, just because of the timing. So I think it was a February we went to Performance and Resources Committee. The next one to Performance and Resources will be August, so we'll probably be after that. So it'll be potentially the September Performance and Audit Committee meeting. So that will be the earliest, I think we would anticipate. That'll be the earliest they'll be able to present that point. Okay, there's a lot of there's quite a lot of concern about these waiting times and the trajectory. I think, as David has highlighted, I think it's important that we keep up to date with this, as clearly he is also doing in his other role. Thanks very much indeed, Dave. So we note the recommendations from 2.1 to 2.2. Thanks very much indeed. Marlene.
Item 7, Care Inspectorate Gradings, Registered Care Homes for Adults and Older People and Other Adult Services. It's for noting, and Catherine will speak to it.
Thanks, Arlene. So this is the annual report that summarises the inspection activity for social care and social work services over the last year. There were 45 inspections last year for services in Dundee, 26 care home inspections and 18 in other adult services. This report links to the indicator 17, the national indicator around inspection gradings, and it's fair to say that there was a significant dip in performance both in Scotland as a whole, but in Dundee post-pandemic. But in every year since then, there has been significant improvements, again, both across Scotland and within Dundee, and that has continued into this year. There's improved gradings, including significant decreases in the percentage of grades at where we have a service that's got 3 or less, so good or less for all grades. In the care home sector, in particular, big changes and improvements this last year, which is good to see and building on the progress in previous years. There's also been no unsatisfactory grades in the past year in the care home sector, which is a slight change from the previous year as well. Just worth noting that the 3 care homes that are operated by the Health and Social Care Partnership, internal ones to us, ended the year in very good gradings, so grade 5s, which again is a good assurance in terms of the internal provision of services. For other adult services, there's a similar pattern in terms of a reduction in the number of services that had lower grades across all of their elements. And 2 services in there achieved a grading of 6 of excellent, which is no mean feat in terms of the Care Inspectorate grading scale and the inspection regime. So that was Take Care at Home and the Richmond Fellowship. So congratulations to them and all the staff from their service that were involved in achieving those gradings. As always, the report and the appendix that Rosalind Guild prepares has quite a lot of other contextual information, both in terms of the enhanced support and monitoring for services where there have been significant concerns in terms of grading and the general support for services. But at section 4.3.3 and in the appendix, we also really try to highlight some of the really positive performance that comes through from the inspection regime, and some of the themes in terms of high performance services have been around person-centred and compassionate care, having a motivated and well-supported staff group within services, good consistent leadership and oversight, having effective quality assurance in place, and very good systems for communication between services and service users and their families as well. So those were some of the key themes from the positives, but there's service by service information in the appendix around some of the positive aspects as well. So that's kind of the summary of the data. I'm just checking if Angie's joined, which she has, in case there's anything she wants to say from a kind of operational service delivery perspective.
I think that's good enough, Catherine. Frankly, I think we do.
I don't think there's anything I could add, Bob.
Yeah, thank you. And you know, this is quite an important document actually in the public domain, and for those who are making decisions, it's an enormously helpful document. Any questions on this one? I think the report speaks for itself. So we note the recommendations in 2.1 to 2.3, and particularly the range of continuous improvement activities. I think that's quite, that's very positive. So thank you very much indeed, and it just goes to show how much good work the Care Inspectorate does. Excellent. Thank you very much indeed. Arlene.
Okay, that takes us then on to item 8, self-assessment annual review of 2025-26. It's for a decision, and Christine will present.
Thank you, Arlene. Yeah, so this is now part of our sort of best practice and good practice, and part of the PAC terms of reference as well, in terms of recommending that the PAC reviews its business that's undertaken during the last year, and presents the information to, or subsequently presents information to IGB for assurance purposes around the reports. So this is brought to committee to allow members to look back at all the different reports that were undertaken during 25-26, to actually allow the report to be written in terms of the assurance to the IGB, and also for PAC members to be confident and comfortable that all the business that's been presented can be fulfilled within the remit of the PAC terms of reference, and allowing yourselves to operate effectively and fulfil your duties. So the report, a summary of all the reports are provided in section 4.4. As you can see, there's a number of reports that are coming on a fairly regular basis, either to every meeting or every second meeting. Some of them obviously are annual reports as well. And the way these have been grouped into the sort of categories around governance, assurance, performance, the annual accounts, and the clinical and clinical care and professional governance categories as well. Obviously, yeah, I'm happy to pick up any questions. I think it's relatively self-explanatory what is there. There will be, saying to the next IGB, well, not to the next one because the timing of it, but for future IGB, there will be the assurance report taken to that meeting, and confirming the on the basis that we're looking at probably a reasonable assurance. I would be considering to take to IGB. But happy to pick up any questions around this, and if members have got any points around the ability to actually undertake these and rent through the terms and conditions or anything as well, we can pick this up.
David.
Yeah, Christine, this is obviously it's a short and to point paper. This just on the back of that, we are looking at ourselves and seeing how we are performing and in line of compliance, I guess. But is there any, maybe this is one step too far, but is there any sort of form of comparison between performance of the Health and Social Care Partnership Dundee and PAC against other Health and Social Care Partnership performance on the same basis? So, is there a sort of benchmarking process, or is that just one step too far?
I've not actually sort of looked at that. I am thinking about just even the work that gets undertaken. Obviously, I speak to colleagues in Angus and Perth and Kinross fairly regularly, and for example, I think in Angus they have an audit committee rather than performance and audit committee, and they're actually moving towards having that performance. So there wouldn't necessarily be a direct comparison around the roles and remits as it stands in that particular circumstance. But I think that they're sort of moving towards that. So, in terms of the benchmark, we might need to be careful around that we're actually comparing apples with apples in terms of the role and remit of the Performance and Audit Committee in different IGB areas as well. But it is maybe something that I can pick up with colleagues directly across Tayside, and just to see if that would be an appropriate next step in terms of any sort of benchmarking comparison.
Yeah, I'm not being critical anyway. I'm just thinking that I'm always very cautious about self-assessments in these sort of things, and I think it's quite useful to be able to kind of compare and contrast on the issues like this. And it's I know it's subjective, but I just think it might be of interest. But with other pressures and things, it's maybe not so much of a priority. But I'm just always a bit cautious, as I say, with self-assessment.
And can I pick up on that point I think David's making? I think it's, for me, it's much more to do with the processes rather than the final report itself. And sometimes, and as I know that you do, after the performance and audit committees, you have a more informal session with internal audit, etc., where you're able to have an opportunity to discuss some of the issues that could, on reflection, could help to improve the work of the committee. And I think there's something about looking at that a wee bit more, I would have thought, where team members could be involved in that process as well. It just simply is a quality thing, really, to look at the issues, because I think the benchmarking one's quite is tricky and difficult. Well, although I do think you could learn quite a lot from it, but I do think there's something about involving some of the committee members a bit more in this process of self-assessment so they can reflect on just how the committee operates as a body, and not just looking at the governance areas it covers, that could be helpful, I think, for looking at where things could be improved. It's just a suggestion.
Yeah, I can pick that up then with internal audit colleagues as we're going through. You know, we've and how we build that into sort of improving some of this. There has been sort of other internal audit reports and internal control evaluation things around that are going in the governance statements and things that are ongoing just now. So it may well be something then that we can look at how we further enhance some of the processes appropriately going forward.
And also, it's always a chance to look at terms of reference as well. You know, when you're looking at that, see, do we need to tweak this in ways? So that would be my suggestion for that. And I see there was a supportive comment from MS, and I have to work out. It's Martin. It's Martin. Thank you, Martin. So that would be quite helpful. So maybe you take that away and bring it back to. Can you make that an action point to bring that back to the next FAC meeting in September? Thank you. We'll just see whether there's any traction on that. And I should put my spectacles on.
Barry.
Barry.
Yeah, thank you. I don't have any problems with the committee self-assessment report, but I just wondered just about the strategic risk register. It says it's been regularly reported to the PAC, but it actually has only been to 2 meetings. So I understand the reasons why, because it's obviously been developed, a new corporate risk register, but that might be something just to highlight in this self-assessment with just a little bit of narrative.
Yeah, it would be good. I mean, I think that's one good example, because there has been quite a lot of changes, and we'll see that in the later paper on the strategic risk, for example, just to kind of inform members as to why these changes are necessary as well, and why we do need to keep focus much more on certain areas. And it helps for FAC to be in tune with the times that they're going through in many ways. Okay, right, we've got this action point, and thank you very much indeed, Valerie, for raising that point as well. So we note the recommendations in 212 and 22. Thank you very much indeed. Okay, Arlene.
Okay, item 9, quarterly feedback report, 4th quarter 25-26. It's for a decision and will be presented by Claire.
So, looking at the 4th quarter, sorry, I'm moving down in section 5.1. We've got the numbers of complaints received and closed. We've got a slightly new format for the feedback report. So this quarter we've had, in comparison to this time last year, we've had slightly more complaints received for social work, and we've closed slightly more than we received, and likewise for health, slightly more than this time last year, and we've closed more. So there's been a big focus on closing complaints. Our timescales that we've got for responding, if we look at section 5.3, for stage 1, we're generally quite good. So we get around 3/4 closed within the timescale, and stage 2, and that dips slightly for health, we're down to 40%, and for social work, we're down to 67%. And then for escalated, that they're more complex. So again, that dips again. And the range of complaints outcomes that we've got, so partially upheld or upheld, it just kind of gives a general view that there is a wide range of the outcomes that we have to complaints, which suggests that, you know, they are all looked at individually and responded to on the merits of the case. So planned service improvements that we're doing, they follow on from complaints that are upheld. And if we look at our open complaints, just to show that we're regularly monitoring them and the governance around these. So as of the 20th of April, you can see the figures that we have there. So the ones that were open for longer, there's just 2 that are beyond 2 months old, but these are regularly looked at, weekly meetings. And care opinion continues to be developed. So we are getting more reporting available from care opinion. We received 55 stories and 37 have been responded to. And I think that the response rate is slightly low there, so not all been responded to, but that I think is because of the mapping. So we're getting some that are coming through and it's not easily apparent to us which team is responsible for it, but we're continuing to map those services and improve that quality.
Okay.
And yeah.
Oh, that's fine. Thank you very much. Any questions for Claire?
Yes, I've got my hand up.
I see you, Helen. Hello there. Welcome.
Hi. Can I apologise firstly for being late? I actually didn't read where the venue was and went straight into the city square. So I had to come home because none of the equipment's working down there today. So I apologise for my late arrival.
Don't worry, you're not alone, Helen. I think the DH&SCP have followed the emails today. Thank you very much. What's your question?
Yes, the questions on the escalated stage 2. 67% is quite high for social work, although I do know that there have been some sorts of problems. Is there any particular type of case that seems to be coming to the fore? Like, you know, what are the complaints? Are they roughly the same, or what type of complaint has been coming in?
So for that one in section 5.3, that's the close within timescales. So that's social work for escalated stage 2. So that's where it's been to a stage 1. The person's not been happy with the outcome that they've got from the stage 1, and then it's moved on to the stage 2. So these are these ones. So 67% of those for social work were closed within that timescale for that escalated one, but for health, it's none. None have been closed in that timescale. And my understanding is that a large proportion of our escalated stage 2 complaints are for mental health. They're the health complaints, and those by their very nature are very complex. And the mental health team do work very closely with the complainants, so that they're in agreement with the treatment plan and with the complaint outcome. And what part of the governance work that we've been doing with the investigating officers is to kind of ensure that they understand that the complaint and the treatment plan can be different things, so that actually what we're trying to encourage them to do is to close the complaint, even though the treatment plan might not be fully finalised at that point. So that's in line with the guidance from the SPSO, the model complaint handling. That's the advice we've got as well. So I think a lot of those are very complex, and the largest proportion of our complaints is from mental health.
Okay, that explains it. Thank you.
David.
Yeah, thanks, Claire. I think mine looks less here at the figures and percentages and things in closing. It's more general, I think. Bearing in mind we're talking about feedback here and complaints generally. Is there any, rather than complaints about isolated issues that people may actually incur during service provision, etc., is there any sort of common issues that are there that refer to more that are systemic, effectively, you know, and rather than just an isolated issue? Are we seeing sort of in certain services recurring themes of complaints?
Yeah, so what happens is the complaints teams for health, the patient experience team, they will categorize the complaints, but there are so many categories, and actually we've reported on them in previous reports, that it's kind of meaningless, because it might be staff attitude, disagreement with treatment plan, etc. But there's many categories, and so it just comes across as a large list rather than being able to see any patterns. But would probably waiting times and access to treatment and disagreement with the treatment plans, that would be some of the things. I think as we develop, so we're kind of improving this report kind of in conjunction with Matthew, but we do aim to get more kind of more narrative and those kind of themes coming through. But the way that it's recorded in the databases that we have access to is actually, there are so many categories that it becomes just a list rather than any patterns, but waiting times and kind of capacity is a big factor.
That's interesting. Thank you. It's helpful.
Dave.
Yeah, I was just adding because Claire mentioned about kind of linking in with Matthew around it. So just, I mean, so there is still a kind of section within the clinical care and professional governance report, so clinical governance report as well about the complaints, and there's a bit more detail on that, but kind of covers what Claire's just described anyway. But so just kind of connecting that up between the complaints will all feed back through into that clinical governance. So any kind of areas of significant risk are flagged up through there as well.
Thank you very much. Just looking at the graphs themselves, even just looking at stage 1 and stage 2, does anyone actually meet the standard? Is the standard itself, does that fit for something that's broadly generic across the public sector for the health and social care world? Does it? Does this fit for us?
Sorry, I don't understand. Are you?
Well, I'm just looking at your graphs in 5.2, and the figures seem to suggest that the standard says 5 or 20 on the on stage 1 and stage 2 average days to respond, but the real figures are higher than that. So is there something fundamentally that needs to look at the standard itself?
Well, those standards come from the Scottish Public Service Ombudsman.
Yes,
so
I know.
So yes, yes.
The question.
So, but I mean, the stage 1s are we're doing quite well for stage 1s. It's 5 days or an additional week. So we do quite well with those because they are straightforward. But when you're dealing with really quite people we have long-standing relationships with a lot of our patients and service users, so there could be a lot of information to gather for the investigating officer. I mean, our referral rates to the SPSO are very low, so and when we do get complaints taken on by the SPSO, they very often find that they're not going to take them, they're not going to look at them any further, or so that would suggest that our investigations are undertaken very thoroughly and that our complainants are actually satisfied or understand. If not satisfied, then they understand the reasons why, I think. So, yeah, there is a balance, isn't there, to look at a complaint fully and or to get it done within timescales.
Well, I just think because there are different expectations from NHS within this, there's a fundamental problem with this. So how do you actually get things done in a tedious way, as you've indicated? It just feels a very difficult exercise. And it's not the first time, and I'm sure the conversation with Catherine about shared data, and I'm sure I don't need to remind her of that. And if we're going through a kind of potential complaints process where there are different organisations with different ways of doing this, it strikes me as a pretty fundamental problem. Just as a lay person on this, and I think it's interesting. You know, when I was looking at the bits that are from care opinion, 2% were moderately critical, and I was kind of thinking, well, what exactly does that mean? Does that mean there are issues around the systems, or what? Are we getting into whistleblowing territory here? Just a reflection, really, Claire.
Yeah, that's the care opinion who assess those. So
yeah.
if they're assessing it as critical, that would be people, they are concerned about people's welfare, so they would flag us up.
Yeah.
But yeah, the vast, so that's that. It's something that they think that we need as a service to take action with and to flag them up.
Okay then, thank you very much. We therefore, I don't see any further questions, so can we note recommendations in 2.1 to 2.5? And thank you very much indeed. Arlene.
Okay, so that takes us on to item 10, Strategic Risk Register update. It's for noting, and this is also Claire.
So the new format of the Strategic Risk Register. So since February, the financial sustainability, workforce capacity, property infrastructure, public service reform, increased service demand and digital infrastructure. So there haven't been any changes to these risks, but that for the financial sustainability, external provider sustainability and engagement, the additional mitigating actions have been added to those risks. So they didn't resist, wasn't any change to the residual or planned scores for those risks, and that we are addressing the need for assurance plans for the strategic risks that are shared with NHS Tayside and Dundee City Council, and that will be reported to you at the next meeting in September. And then from page 105 onward is all the reds and the greens and the ambers, which is really good. It's a lot clearer. So previously this information was hidden, but it was hidden on IdeaGen. So Pentana wasn't able for you to see it. So this is laying it all out. You can see especially the out with appetite risks that we have, which is for financial sustainability, property infrastructure, public sector reform, increased service demand, and the digital infrastructure.
Okay, thank you. Questions? Martin.
Thanks, Chair. As you probably will guess, I'm going to ask a question about the digital infrastructure. What mitigation actions can we do to reduce the risk on that, or is there nothing that we can do at this time?
Dave?
Your digital infrastructure question.
Yeah, it's quite a tricky one for us in the IGB side of things, given we don't actually control the digital resources themselves. So it is around that kind of engagement with our two statutory partners around what they provide around digital infrastructure. So we do have a digital group within the partnership itself that kind of looks at areas that we want to see developed, and then it's then we would then take them into our kind of corporate bodies equivalent and kind of governance meetings to kind of push for the resources that that we think we need around that. But just at this point in time, where we're at, we're not where we would want to be in terms of the provision of that digital response against our ambition as a partnership around that. So so there are routes into it. That's the only way we can influence, and being very clear in terms of what our strategic vision is for the health and social care partnership in terms of digital.
And Dave, oh sorry, are there further questions? I was going to ask it about the determination of the appetite. Has this been done through the IJV in terms of determining their appetite in these areas? And when was that last done?
It was Catherine will come in with a bit more detail on that, but we have gone through this as a board. Sorry.
Yeah, no, I'm just wondering when was the last time we did it. That's my question, really.
It was at the start of last summer, and I think there was a discussion when the IGP signed this off in February, I think it was, about revisiting that now, because there's recognition that once you see the appetite applied within the actual risk register, that may change people's views and opinions about things, etc. So that's on the list of development sessions to run with the IGB over the next few months in terms of revisiting that. Now you can see it in context.
Oh, thank you. Because that was really, it was a timeliness of it, because obviously our context has changed even more so the last year. So the appetite may have changed somewhat, and so it's interesting. People have got different ways of recording this. So because I've been more used to the NHS one, but this is interesting in itself. But financial sustainability out with appetite. Well, you're kind of looking for quite a long range of mitigations into that one, I would have thought. So I think the timescale on revisiting this is really important. So is this likely to come does it sound as though it's going to come to the June IJV?
We'll need to look at a date if we can get one in before recess to do a development session, and any changes subsequently would need to come back probably after the summer. Bob, in terms of the timeline now and dates that will be available, because we need to do that as a kind of development session and have that conversation first before it comes back. So I would think August would be the earliest it might come back, depending on what we can get.
Let's hope we can go with that then, because I think it's quite important. And any further questions on this? Oh, David.
Yeah, it's more of a comment, Bob, if that's okay. I think Claire, I think you referred to. I really like this new style and presentation here. I think it's very similar to, in some respect, we have a performance and resources committee, and we have a performance report, and it's very similar in that, and it gives the headline news at the top, really there, and then when you want to look at each particular risk in detail, you can go down, and the detail there is very clear as well and to the point. So thank you for that. I really like probably one of the better presented ones for risk, I think. I think, if anything, I think what I worry when we look at these risks generally like this, I often wonder, when we're trying to when we're trying to mitigate risk, are we mitigating, the operational issues that are coming out here, or are we actually starting to tackle root cause of problems, and things? It's a general comment, but when I'm looking at these things and I see them as clearly set out as this, I think, what are we doing here to contain risk, and is that being contained for ongoing operational, or do we get under the covers and trying to mitigate the root cause of the problems and things? It's more of a general comment I'm making, but that's the way I think when I'm looking at these. Thank you. I'm not being very clear, perhaps, but it's my own words. Thanks.
Well, we've got the opportunity at the development session that Catherine's just outlined, I think, to go into this in more detail. Catherine, do you want to round this off? I think Raymond wants to go. Raymond, I'll bring you in now, and then I'll get Catherine to deal with any further comments. Okay, Dave?
Thanks, Bob. I mean, it's really just a comment as well, and I think the development day would be good, because I look at this report and I'm quite worried. I mean, I hate seeing red. You know what I mean? It's that kind of thing, and it's understanding. Although the details further in the document, it's about assurances as well, a little bit around how so to sit at these things that say extreme and out with appetite is really, really concerning. It's about what's happening in the background, I suppose. And I suppose it's for a development session, but I'm apologies if I've heard. I've tried to understand the difference between detective and preventive that's described in the report. So what does that mean? Apologies, I didn't understand that.
Catherine, do you want to round us off?
Yeah, Raymond, we can reissue the risk management framework that sits alongside this, that defines those that the IGB signed off in February. And David, yeah, to just taking your point, I think the control types help with that kind of oversight of how much of it is firefighting versus how much of it is around the kind of preventative element. And I think you're right, when you look down that control type row, most of them are more in the corrective after the fact rather than preventive. There are some, but I guess that's why we adopted that control type approach from in the same way that we had from the other elements from the Perth and Kinross kind of template that we worked from to allow people to see that, but also to pick up that issue that you're talking about, that sometimes we're still reacting rather than being able to really get to root cause prevention stuff. So I think it's a fair point.
Okay, thank you very much. I'm going to wind this one up. So we can note the recommendations and particularly including the Strategic Risk Register report. Thank you very much indeed. And thank you, Claire. Thank you.
Okay, so that takes us on to item 11, Assurance Report, Implementation of IJB Directions 25-26. It's for noting, and Christine will speak to it.
Yeah, thank you. So again, as part of sort of best practice, the PAC is asked to look at the directions that have been issued from the IGB's perspective. The directions effectively are back to our partner organisation, the NHS Tayside or Dundee City Council, in terms of instructing them to undertake actions and decisions that the IGB has made. So the directions policy and the key aspects of the directions policy is noted in section 4.5 around what the directions should be doing in terms of this. And the directions that have been issued from IGB reports are noted in the table in 4.6. This includes all the directions that were issued through 25-26. But actually further down the table in 4.7, there's an updating summary of the directions that were issued through 24-25 in terms of those that actually extended into to last financial year, in terms of actually update dates and progress that were still basically outstanding at this point last year. Most of the directions have been completed and undertaken, and the relevant actions and progressed within the original timescales. These have been noted in the table. There are a few that obviously are still due, still work in progress, and the dates are not yet here. And there's a couple actually from the previous timescales, the previous 24-25, where we would have been expecting updating reports brought to the IGB prior to today, but due to sort of slippage in the initial start of projects, those have slipped, and I've noted sort of refreshed dates in terms of bringing out reports back to the IGB, in terms just for assurance purposes around progress and actually delivery of the actions. So this report is presented in terms of noting for PAC and assurance purposes to confirm so basically for awareness in terms of progress around the delivery of directions and the completion of these. Again, happy to pick up any questions or any points anybody has around this, and noting sort of the progress and the actions that have been undertaken.
I don't see any questions. I do know there's interested to look at where we might be with directions when we come to later on in the year in terms of reviewing the integration schemes. Does further work need to be done on directions? Likely, I guess that will be part of the conversation as well. Dave?
Yeah.
Yeah, just to add to that, so out with the kind of the review of the integration scheme, we will be looking at directions in terms of the kind of approach across Tayside, so in line with their part with them. There are kind of two other kind of IGBs and that interaction with their partner bodies. So there is work ongoing around that one that will bring to a future IGB.
Thank you very much indeed. So this report is for noting. So thank you very much, Christine. And that then takes us to Arlene.
Item 12, which is the Governance Action Plan Progress Report. It's for noting, and Catherine will speak to this.
Yep, this will be very brief because it's pretty self-explanatory, I think. So we've had 7 completed actions since the last report. Those are largely related to actions which we closed off as part of the review of the Strategic Risk Register. 28 actions ongoing, 8 of which had progress in the last period. Of the 20 that didn't have any progress, there's 9 of those, so about half, which are linked to a particular timescale. So there are things that can only be done at a certain point of the year when an annual report is done, etc. So they've not been progressed on that basis, but a lot of those sort of opportunities are coming up in the next reporting period. So we'd expect a number of those to move on in the next wee while. The only other thing to say is just reflecting back on the action tracker. There is an action there in terms of speaking with Audit about any of the outstanding things where there are particular risks and about the opportunity to rationalise. And I'd suggest that, you know, other than those 9, the remaining ones are ones where there is a level of duplication. So hopefully we can have that conversation with Audit colleagues in the next period and update on that in the next report to PAC.
Comments for Catherine? David.
Well, just a very quick one, Catherine, really just back further to the previous conversation we just had. Is there any particular actions there from a governance point of view, shall we say, that that cause the greatest impact on risk of everything that's in there? Is anything, because that's kind of what I was referring to before. Here we are looking at governance and actions into saying where there's any delays and things. Is that having any impact on risk as you see it?
So probably, I'll not surprise you, David, I would say the ones that in the gap that relate to savings and transformation reporting and service redesign around financial sustainability are the ones that probably are most closely linked to the risk register. As well, there are other elements that are perhaps a little bit more administrative and tidying up around good governance and recording and things like that. But actually, the ones that are probably most fundamental are those that are linked to that kind of transformation service design. How we are managing that and reporting on that are probably the key ones.
Yeah. Okay, thank you.
Okay, this report is for noting. Thank you, Arlene.
Item 13 is the internal audit plan progress report. It's for noting, and Christine and Barry will speak to this.
Thank you. I'll just nip in.
Sorry, can you hear me or not? I couldn't get.
I can hear you. Okay.
Yeah, I'm sorry. We're getting some feedback actually, or I was getting some feedback there. Yeah, I'll just very quickly just introduce and then I'll let Barry chat to it. So yeah, the regular internal audit progress report is here. There was an action again on the action tracker around putting in links to sorry, there was there is some action tracker link request to put in links to reports from our partner bodies as well. So that's built into this report where it's appropriate. The report is there, the progress around it, and some of the feedback from reports that have been taken to NHS or Dundee City Council as well around some of the reports that may be relevant to an impact onto the IJB as well are noted. But I'll let Barry take us through the main content of the report as well. Thank you.
Yeah, thank you. I think just want to highlight, in addition to what Christine's just said, since the report was finalised, 2 audit reports have actually progressed. The field work on the internal audit, which is referenced DO 525 lead partner services, that's now complete. The Chief Internal Auditor has reviewed the report and will be issuing that to management in the coming days. Also, the internal control evaluation report was issued to the IGB officers yesterday, and we plan for that to be reported to the IGB in June alongside the internal audit report. But there also may be an opportunity once the ICE report has been finalised for it to be issued to the members in advance of the IGB meeting, because I'm very conscious there's not a pack before that IGB annual accounts meeting. Nothing else to highlight within the report as it stands.
Okay, thank you very much, Barry. Questions for Barry? And I was just going to ask Christine and Barry just a general thing around about GIAS itself, where there's a stronger emphasis on outcome impact assessment that we're looking for. Are we seeing more of that coming through in the reports that we're getting?
Is this, sorry, are you talking about the global internal audit standards?
Yeah, that's the standards we're working to.
Yeah, I mean
that was around the prioritisation of value added link and the requirements in terms of significance, likelihood, and impact. So I just raised that point.
Yeah, we've been up to across our sort of the FTF partnership, which is across 3 health boards. We've been taking forward an improvement plan in relation to the global internal audit standards. But part of that, in relation to what you've just mentioned, was we've looked to enhance our sort of reporting template, and where we've got sort of findings, we're actually trying to sort of we have a section within the findings around the impact of our findings and if there's any risk related to them. So we are trying to sort of evolve our reporting to meet these standards as we go forward. You'll see that within the ICE, once it's finalised, it's probably that does have within the findings part of it what we're calling a sort of an impact and sort of risk assessment of what we found.
Okay, thank you very much indeed. Thank you, Vani. Thank you, Christine. There's photos for noting. Arlene.
Okay, so that takes us now on to item 14, which is the attendance list, which is submitted for information and record purposes. And then item 15, which is the date of the next meeting, which is Wednesday, the 23rd of September at 10 o'clock.
Thanks very much indeed. Thank you. And thank you, everyone. And thank you for your contributions.
Thank you.
Thanks very much, everyone. Bye-bye. Bye.
Okay.
Bye.